there are several promising approaches that are being explored to enhance CAR-T efficacy in hematological malignancies. One major focus is on the novel costimulatory domains beyond the traditional CD28 and 4-1BB. There are attempts using the inducible MYD88, so the CD40, which can fine-tune CAR-T activation and persistence, and others like OX40 and others. So there are also key area of expertise and attempts to improve CAR-T efficacy by using tracks. So not only the expression of CAR-T, but also of specific cytokines like interleukin 15 or 18, which can be used to prevent the exhaustion of T cells, but also to increase the penetration of the cells into the masses. So this is more a discussion about more affine to a solid cancer therapy rather than hematological malignancies. But when we are talking about lymphomas, we are somehow in between of the two. On the manufacturing side, there is increasing interest in allogeneic or off-the-shelf CAR-T therapies, including gene-edited T cells that resist graft-versus-host disease while maintaining potency. And also, it has been shown that a faster production method can increase the percentage of T stem cell memory and T central memory immunophenotype transduced T cells. And those cells are important for the persistence and expansion in vivo. While if our manufacturing leads to terminally differentiated effector cells, those cells will be very effective at the beginning, but they will not last long in vivo. Regarding the production of allogenic therapies, we are also doing some efforts in the iPSC field. We do have a project where we investigate the use of HLA haploidentical iPS in collaboration with the Banc de Sang it exists in Barcelona to generate gene-edited and CAR-engineered allogeneic therapies for the forthcoming generation of clinical-grade cell bank. On the other hand, also in vivo CAR-T production is very promising, as I was saying, and active field of research, which would decrease significantly the cost of this therapy. However, this approach is still in its infancy and as compared to more established platform. So altogether, this innovation, I think, are driving the next generation of CAR-T therapies, and also the mRNA field, the use of mRNA to produce transiently expressing CAR in vivo. And all those are meant to improve durability, reduce toxicity, and expand their applicability in hematological cancer. And not only, actually, also for solid tumors. There is a lack, of course, of new targets. There are some which are being explored recently, like CD70, CD123, and FCRL5, the FC receptor like 5, which targets different malignancies. For example, CD70 has been tested in AML, MCL, and T-cell lymphomas. CD123 has been tested in AML. And FCRL5 has been also tested in combination or along with BCMA therapies in multiple myeloma, where you can use both CAR-T therapies or specifics. So I think this is the direction that the field is taking, and we are keen to follow with our innovations.